When the heart stops, brain cells begins to die after 4 minutes, and the chance of recovery after 15 minutes are almost zero. That's why I will share with you 5 essential life-saving first aid tips. This can reduce the risk of death by 60%. First scenario is when a person is unconscious but still breathing. Place them on their side in the recovery position. This means you should roll them gently on their side. Their head should be tilted back slightly to keep their airway open. Once positioned, top leg should be bent to prevent them from rolling onto their stomach. This position is useful after seizures or during the drug or alcohol overdoses or in case of hand and spinal injuries. The recovery position is important because in other positions, the person may choke due to the collapse of throat and tongue tissues. If a person faints due to fear or at sight of blood, this method is still applicable, but elevating the legs can accelerate the recovery process because it helps blood flow from the legs. The second scenario is severe allergy. It can be fatal. It is called anaphylaxis. Symptoms of anaphylaxis are itching skin, swelling face, lips and tongue and throat, difficulty breathing, and rapid drop in blood pressure. This can lead to a collapse and potentially death from shock and narrowing of the throat. The solution is epinephrine injection. Brand name is EpiPen. This epinephrine injection should be made on in the tight. Common allergens which can cause anaphylaxis are foods like nuts and shellfish, insect bites from bees and wasps, and medications. The third scenario is when a person is unconscious and not breathing, or breathing abnormally. Here, cardiopulmonary resuscitation is the first-line treatment. It is called CPR. Place the heel of one hand on the center of person's chest. Place your other hand on top of the first hand and interlock your fingers. With straight arms, use your body weight to compress the chest at least 2 inches deep. Make 120 compressions per minute. After the 30 compressions, give to rescue breath with tilting the victim's head back slightly and lifting the chin up, pinching the nose shut, and covering the person's mouth with yours to make a complete seal. Blow into the person's mouth to make the chest rise. Give 2 breaths, each one lasting about 1 second. Continue CPR until medical help arrives or the person starts showing signs of life. CPR is particularly crucial in suspected drowning cases. At this case, don't try to drain person from water, it's misconception. Call emergency and start CRP as soon as possible. It is advisable to move the victim to a firm, flat surface before starting CPR. 4. The choking rescue procedure. It is used when a person is choking because a foreign object is blocking their airway. Stand behind the person who is choking and wrap your arms around the waist. Tip the person forward slightly. Make a fist and place it against the middle of person's abdomen, just above the navel and below the ribcage. Cover your fist with your other hand. Quickly push inward and upward, aiming to increase pressure in the airways to expel the object. Continue performing this abdominal thrust until the object is expelled from the airways or the person becomes unresponsive. This procedure is called Heimlich Maneuver. And 5. Stopping bleeding. General principle of stopping bleeding is applying firm pressure directly to the wound using a clean cloth or bandage. This is critical as severe bleeding can lead to shock or death. If the bleeding is from a limb, raise the limb higher than heart level to reduce blood flow. If the bleeding does not stop, use tourniquet or belt. Place the belt 2 or 3 inches above the damaged area and tighten enough to stop bleeding, but not so tight that it injures the tissue. Don't place tourniquet over a joint. Keeping a tourniquet or belt on for more than 2 hours significantly increases the risk of irreversible damage of the limb. If there is bleeding in the stomach due to trauma, don't apply direct pressure as it can worsen the situation. The person should lie down and remain as still as possible, minimizing any activity and any movement and waiting for help. The injured area should be covered with a clean cloth to protect it from contamination. If there is a gunshot wound, cover the wound with clean cloth, but don't apply direct pressure because it can further damage tissues. Don't try to remove if something in the wound because it can worsen the bleeding. Keep the person warm and still until emergency arrives.